And now it's time for the sponsor perspective portion of our program. Please welcome Stacey Stewart, President and CEO of March of Dimes, and Nina Westbrook, Founder and Editor-in-Chief of Bene by Nina.
Thank you, Steve. I'm Stacey Stewart, President and CEO of the March of Dimes. And as the nation's leader in the fight for the health of all moms and babies, our team works through programs and advocacy, research, and education to ensure that every mom and every baby has the best possible start. Today, the U.S. remains among the most dangerous developed nations in the world in which to give birth. And that's especially true for communities of color. As shown in our recently released report card, the U.S. preterm birth rate declined slightly for the first time in 6 years, from 10.2% to 10.1%. Black and American Indian Alaska Native women remain up to 60% more likely to give birth preterm as compared to white women. These stark disparities cut across all measures of maternal and infant health, including the rates of maternal death and severe maternal morbidity, which continue to rise. To change the course of this crisis, we must take action through partnership and bipartisanship. Our report card outlines the following policy solutions, part of our #BlanketChange agenda, which can make a difference. We must start by passing the Black Maternal Health Momnibus Act of 2021, which will improve health outcomes for moms of color and tackle longstanding disparities. We're also seeking federal legislation to extend Medicaid postpartum coverage from 60 days to 12 months and make it mandatory for states. States and the federal government must support and fund maternal mortality review committees and perinatal quality collaboratives that are critical for tracking and increasing our understanding of maternal and infant health. States must support midwifery and doula care legislation and policies, which can help improve access to care in under-resourced areas, improve birth outcomes, and reduce rates of maternal death and illness. As this year comes to a close, Congress must prioritize the health of moms and babies. We're optimistic that the initial down payment for most of the Momnibus bills and the extension of Medicaid postpartum benefits will remain in the final Build Back Better package. Learn more and get involved at blanketchange.org. Now I'm excited to spend time with our fellow advocate and special guest, Nina Westbrook. Nina is the founder and editor-in-chief of Bene by Nina, a digital environment that offers resources and e-workshops to help cultivate wellness in every area of life. She's also a licensed therapist, a devoted mother of 3, and she's also married to NBA All-Star Russell Westbrook. Well, Nina, I'm so pleased to have you with us today, and it's just really a pleasure to speak with you. You're a mom and you're also a therapist, and so you spend a lot of time thinking about mental health for moms and the impact that it has on families and children. I just would love to hear you talk about your passion around mental health and why you think it's so important that we all have an understanding of how both our physical, our emotional, and mental health really impacts all of us, but especially pregnant women and moms. If you could just talk about that a little bit from your perspective.
Absolutely. And thank you so much for having me. I'm so excited to be here with you, having this really important conversation. I believe that obviously mental health for me is essential, not only for expectant moms and new mothers, but I come from a sports family. And so I always kind of grew up understanding the importance of both physical and emotional and mental health, and combining all of these aspects together in order to get the best outcome or the best performance or whatever the case may be. So in order to create the most well-rounded and balanced human being, even though we can't strive for complete balance, we want to work towards that. And I feel like my work as a therapist and mental health professional has always been predicated on trying to help encourage and assist others, especially mothers and young women, to achieving that balance and understanding the importance of their mental health. The connection between the uncertainty that we've all kind of experienced during the pandemic is kind of gives you a little bit of insight into the life of an expectant mom or a new mom. and the level of uncertainty that they're facing, right? It can leave new moms and pregnant women in a very vulnerable space.
What would you say are some of the signs that it might be time to call a therapist? And what advice do you give really pregnant women, new moms, or anyone who needs to make that step so that they can maybe get over that hump of a stigma that might be attached to that, or the fact that they never sought that kind of care? How do you help them get to that place where they can actually reach out and get help?
We all need emotional help and support of some of magnitude. And we can't really do all of it all the time and do it well, really, really well, without support from our loved ones. So I would say if someone else is coming to you and voicing concerns maybe about your changes in behavior, or maybe they notice that you don't have that same spark, even underneath all of the sleep deprived tears or whatever the case you may be experiencing at the time. Or if you yourself have gone for a long period of time where you just quite can't figure it out or can't quite get to an emotionally happy or safe or secure place, that might mean or be a sign that it's time to seek out some professional help.
We're at a point in our country where, we recognize that we have not provided sufficient resources to deal with the level of mental health challenge that we face in this country. So what would you, as a therapist yourself, what would you want policymakers to know from your perspective as a therapist?
Expectant moms are always in need of support and resources that can allow them to continue to make the best choices that they can for themselves and for their babies. I think that I see the energy and the effort is there, and they're putting their all into trying to balance and juggle work, career, parenthood, and financial woes or struggles or whatever the case may be. That additional support and help from our communities, that plays a big part. I'm interested to hear what you think policymakers can be doing to change the course of this infant and maternal health crisis.
So one of the things we've been advocating for is, and we're so excited that there is a lot of momentum now on the Hill in Congress around the Black Maternal Health Momnibus Act of 2021. It's really a package of legislative actions, about 12 of them, really designed to sort of remake the way in which women become pregnant and deliver their babies and start their families or expand their families in this country. And it especially looks at the challenges we see with respect to health equity, because we know when we look at maternal mortality and morbidity, Black women and other women of color are far more likely to experience rates of experiences with maternal mortality or morbidity as compared to white women. What we would say is that if anyone is interested in joining with us in making sure that your voices are heard by members of Congress in support of Momnibus, we would just invite people to join our campaign. It's called #BlanketChange. You can sign up to be a Blanket Change advocate at marchofdimes.org. Just please sign up, because one of the things that we know is that when our voices are heard, it can make a big difference.
Wow, thank you so much. I will be signing up for sure. It's not a lot to do to be an advocate for Momnibus and Blanket Change. So thank you for sharing that information with us.
Well, I just want to say thank you for being on with me today. On behalf of everybody, every mom and baby being as healthy as possible is so in sync with our work at the March of Dimes. So we're just so grateful to join with you, Nina. We want to continue to work with you. And thanks a lot for the conversation today.
Thank you so much.
Members of Congress, staffers, and advocates, we need your help. Now is the time for all of us to step up and do more to ensure the health of all of our nation's families. Visit blanketchange.org to learn how you can get involved so that every family has the best possible start. Thank you. And back to you, Steve.
Well, Stacey, thank you. That was a great conversation. Thank you, Nina Westbrook, as well. I'm learning so much on this. I hope all of you are as well. So I'm going to go check out Blanket Change as well.